friend Casey, and she is a nurse at Hershey Hospital, and she's had experience with treating a patient with Addison's disease, and she's going to share her experience. All right. What brought the patient into your hospital?
This patient was a teenage girl who was she had undiagnosed Addison's disease, and she presented to the ER with actually an Addisonian crisis following a pretty bad stomach virus.
Okay. Once the patient was admitted to the floor, what kind of care did you provide for this individual?
Very close monitoring of the intake and output, the weight, daily weights at the same time of the day, close monitoring of the vital signs every 2 hours until the client was stable, and then every 4 hours once they were stabilized for the vitals, watching out for orthostatic hypotension, making sure we didn't sit them up or stand them up too quickly, and teaching them about that, as well as hormone replacement therapy.
Okay. All right. What kind of symptoms did this patient present to you?
Well, prior to her actual admission, she had lost a lot of weight at home and had very decreased appetite, as well as generalized weakness, muscle weakness and fatigue. She was really, really tired all the time, and what had brought her in, what had precipitated the Addisonian crisis, was the pretty bad stomach virus that she had. So that infection is kind of what really put her over the edge. And once she was on the floor, she was still kind of experiencing the symptoms of the weakness and fatigue, as well as pretty low blood pressure, very uneven thermoregulation, randomly being really hot and being really cold.
Okay, what are the symptoms of Addisonian crisis?
People with Addisonian crisis are going to be very disoriented, or possibly even experience a coma or something like that, because when you have an Addisonian crisis, you have very low glucose levels and low sodium levels, so they're very dehydrated and pretty much extreme weakness, like more so than somebody that is constantly dealing with Addison's disease might always experience weakness throughout the day, but this is like to the point where, for example, you might wake up in the morning and not be able to even get dressed and not really know where you are and just be really disoriented. Low blood pressure, being extremely hypotensive is one of the other symptoms of Addisonian crisis. So it's a pretty serious condition. It's like a life-threatening emergency. So for a patient that might be experiencing that, we try to teach them to contact their doctor immediately and get help, because it's a pretty serious condition.
Okay. As a nurse, it's very important to educate our patients. How did you provide teaching to this individual?
Well, especially because this was a newly diagnosed Addison's disease patient, there was a lot of teaching involving teaching her that this is a lifelong disease and that she would need hormone replacement therapy for the rest of her life, and the importance of taking her medication every day, never omitting a medication, and preferably taking it at the same time. The diet is an important factor to touch on as well. People with this disease are kind of encouraged to maintain a diet of many small, frequent meals throughout the day, containing high amounts of carbohydrates, protein, and sodium, to maintain their diet and kind of keep them as healthy as they can be. There's teaching involving reducing stressful situations, kind of reducing stress in one's environment, and if stressful situations do occur, or infections or trauma occurs, to contact your physician as quickly as possible, because an adjustment in your medication dosage might be necessary. So we try to teach that, and also exercising wise, kind of teach them to have rest periods mixed into their exercise program, because people they really tire out fast, and you don't want to overstress your body, and as well as like not exercising on like a really hot day, so that they're not sweating all of their sodium out. And if they are going to be doing that, to kind of know ahead and try to make sure that they're getting the salts that they need, like using salt tabs or something if those are prescribed by their endocrinologist, and definitely following up with the endocrinologist to try to stay as healthy as possible.
What kind of medications did the patient receive while she was in the hospital?
Well, typically in the ER, in a situation like this, like they would get IV saline, dextrose, and hydrocortisone. And then once stabilized and moved up to the floor, maintenance dose of hydrocortisone, and upon discharge she would be placed on like hydrocortisone and Florinef as her maintenance drugs for the disease.
Okay. All right. With Addison's disease, is it possible for an individual to live like a normal life?
Yeah, absolutely. There's just certain things that you have to kind of prepare for, and that's something you would go over with your endocrinologist, like knowing when you need maybe like slightly adjusted dosages of your medication depending on if you've had like a really stressful day, or if you're going to be working out really hard or something. And also the only difference is, in addition to that, is people with this disease should carry a card that says on it that they have Addison's disease, and in case of an emergency, like emergency contacts, their doctor's name, their endocrinologist's name on the card, as well as the fact that like if they were to be in an emergency situation with medics, to inform the EMTs or whoever finds the person that they're going to need to be injected with cortisol like as soon as possible.
Okay.